So we're going to jump into chapter 21, Introduction to Dental Radiography. Um, I'm gonna we're not gonna go through the whole chapter. Y'all already started reading it. I'm just gonna kind of go through little bitty pieces for you to try to add everything up as far as what we did yesterday with the bite wings, PAs, and all of that. Um, so first of all, let's start off with dental radiography. I'm sorry, dental radiographs or X-rays are used to identify dental decay and diseases in the oral cavity, to view the health of the teeth in the surrounding areas, which is the surrounding gums, the surrounding bones. Um, it's also to identify and diagnose suspicious areas of concern, to locate abnormalities in the mouth and soft tissues, to identify foreign objects and lesions, record changes in trauma or periodontal health, to obtain further information from trauma incidents, to provide continued information during and after treatment for implants, root canals, orthodontic treatments, oral surgeries, and so on. Um, Also to examine growth and development patterns, and that's talking about bones also. It's also used to provide information for the preparation of treatment planning, provide a baseline record for the conditions of the patient's oral cavity and dentition, and X-rays are used for patient identification, such as in cases of forensics, abductions, and so on. I don't even know if y'all have ever, well, if you've ever watched like a forensic file episode where they like crack the case just by dental. Uh, Pretty neat. Is really neat. Go try to find something like that to watch. It is super neat. I almost wanted to get into forensics after watching a couple of those episodes. I loved it. Um, all right. So now let's just talk about each individual X-ray a little bit. Um, Give me 1 second. I kind of wrote some stuff up for you. Can you still see me?
Yeah.
Okay. It's hard for me to see. All right. So first we're gonna talk about bite wings. Bite wings are the red. Remember?
Hmm.
So uh, we'll pretend like this is your sensor. You put the sensor in there, and then that way you can look straight through and you see the actual sensor. Same as this flash just said. The bite wing is used to look at a specific area of the mouth. Your dentist may request one or multiple bite wing X-rays during the checkup, and that's fine. Most of the time, I go ahead and get one in the beginning. I'll check the history. I will check insurance claims to see if we're allowed to take another bite wing. If the patient is due for a bite wing, I'll go ahead and take one before we even get started. Whether it's a cleaning, if we're working on that side of the mouth, I will. If we're not working on that side of the mouth, then I will go ahead and talk to the doctor first before doing it because you don't want to waste time that you could be using. But I go ahead and put my patient back and I go ahead and take bite wings first. Each bite wing captures the visible part of the upper teeth and lower teeth, as well as the half of their roots and supporting bones. Meaning, I don't have it. There we go. Meaning, if you're taking a bite wing of this, there we go, you will basically only see this part of the X-ray. Okay, you will get the actual tooth that you can see looking into the mouth, and then you will get a little bitty piece of the top root, and then a little bitty piece of the bottom root. But you're always gonna want that on your bite wings, both arches, maxillary arch and mandibular arch. What else I got? But yeah, basically though, bite wings just help dentists detect decay, and especially between teeth. And not only does it detect decay, but it can also detect tartar, build up plaque that you can't see in the mouth. So even if you're flossing every day, if you can hear a clicking sound, it's probably something in there. So if you were to get a bite wing, it would literally show you where that buildup is at on that tooth. And it's that's something that won't like jump out at you at first until you really get to learn your dental radiograph. But it'll look like kind of like a hook, like a little spur coming from your tooth. That's also pretty neat to see too. I'll try to show you a couple pictures of that tomorrow. What else was I? They also help dentists detect changes to your jawbones, or especially like changes to your jawbones that are caused by gum diseases. Because whenever you do take your bite wing, you'll be able to see like the natural line for the jawbone. But if the patient has like severe decay to the point of they've been needing a root canal for a year and they just let it go, then it's going to start to deteriorate their bones. So that infection down below is not only messing with the tooth and the surrounding areas of the gums, but it's also down with the bone. Okay? And it would literally start deteriorating. So if this tooth is very bad, badly decayed, and you take a bite wing, the gum line will go straight, and then it will just kind of dip down. Now, it might not be a severe dip. Some are like a very prominent dip. But some of the dips could just be a slight dip. But you need to realize stuff like that. It might go straight, like the normal arch, and then just the slightest little dip, and then it'll go back straight. Okay? That's something, if you see that, you can be like, hey, can we, might want to take a PA of that area to see what else is going on. But we'll get to that. If your dentist uses the traditional X-rays, you'll be asked to bite down on a piece of plastic that holds the X-ray film against the upper and lower teeth. And if your dentist uses digital X-rays, you'll be asked to bite down on a little box that's wrapped in the plastic. So that's basically the one that we've been learning. We've been learning the digital X-rays as far as sensors, sensor holders. I will show y'all more on the traditional X-rays, but traditional X-rays are the little ones that I showed y'all on the light yesterday. But it's just a completely different way of actually developing those pictures. You actually have to take the X-ray and then go into the dark room, develop them, and then come back out with them. I'll also show y'all that one day. Um, let's skip down to periapical or PA. So a periapical X-ray or PA is one that captures the whole tooth. So if I say patient is hurting on tooth number 8, then you would know to get your anterior, which is blue, anterior periapical or anterior PA that would go right behind tooth number 8. So that's the only tooth you worry about. Okay. And you bite, you line it up, shoot, just like we did. Well, I'm sorry. I got it right here and I'm doing it the other way. Same as class though. Get it lined up. Perfect. That way it's going straight through there. So if we say take a PA of tooth number 8, you come, tooth number 8, and then you would shoot. Shoot it whatever angle is it. Okay. So in this case, I mean it's not correct only because this is a model, but in this case, this would be your angle. So you would just line your tooth head up right here, shoot it. Um, so basically, a PA shows everything from the crown, which is the chewing surface, to the root, everything below the gum line. Excuse me. Each periapical X-ray shows a small section of the upper or lower teeth. Okay? And these X-rays are often used to detect any unusual changes in the root and the surrounding bone structures. Again, that's a specific area of the mouth. It's not like a bite wing when it's the whole general area that's getting top and bottom. You're either getting the top, the four top, or you're getting four bottom teeth, whichever one. Um, Periapicals are taken when the film will be placed near the mouth using a metal rod with a ring attached to it, which is this, the ring fit. You need to bite firmly into the device and place it in to provide a clear x-ray image. Now, sometimes the patient will complain that it's hurting them, they can't really bite down as much as possible. What you would do in that case, maybe if it wouldn't be this thin, okay? The newer ones are kind of thicker on the bite block part. These are kind of thin. So on the thin ones like these, you want to get your little cotton roll. You go ahead and place your sensor where it needs to be. And let me get this right first. There. And before you get the patient to bite down, you will place a cotton roll right at the bottom. That way when that bite is not digging into the lower teeth, okay? Or the actual gums on the bottom. And that was for the anterior PA. And same thing, if I was to say take a PA up to number 30, it would literally be the same thing. You would go ahead and put your sensor hold on first, and then you align. Line it, go straight there. Down, get them to bite. Just try to blend with it. There we go. Well, there it went. But you get it. Just whichever angle, shoot it at that angle. All right. We went over the different types of radiation as far as was your primary, secondary, leakage, and scatter radiation. We went over all of that.
Mm-hmm.
Something that we did not go over yesterday in class was the FMX or the four mouth survey X-ray, which is every tooth in the mouth, but it's used with your PAs and your bitewing. Okay. So in that case, the way you would start it off, you would do your bitewings first. Okay. So let's put that up. All right. So if you're taking your bitewings, you're automatically going to have your back posterior teeth. Okay, so those are out the way. So your last 2 to 3 teeth, depending on if they have wisdom teeth, the last teeth will already be done. So then you would have to go back. So we got, let's say they don't have their wisdom teeth. So they only have teeth 2 and 3. They don't have one. So 1 is gone, 2, 3. So we got the bite wing, which got these 3. So now you need to come back and you need to start taking PAs of every other tooth. Okay, so being that this is through the posterior, put that sensor back there. You go ahead and take your upper posterior, and you literally just go around the mouth, taking them off. Now you don't have to take one tooth at a time. What you can do is you can literally double up 2 teeth per shot or per sensor. Um, Kind of depending on your dentist too, so you have to check with them. But most of the time, however many teeth you can get in the film, that's fine. That way you don't have 32 single films, you know. So just go around taking all the X-rays. Once you get towards the anterior, then that's when you will start taking your fingers. Okay. like your 7, 8, 9, 10. Um, sometimes, sometimes you can even get another sensor holder that's a little bigger, like the posterior one. Hold it behind, and you can get like 7 and 8 in the same photo. You can skip over. You can get 8 and 9 in the same photo, and you just keep going around like this. And at the end of taking all of your x-rays, the bite wings, your posterior PAs, your anterior PAs, once you're finished with all of those, you will have every single tooth in that patient's mouth in the chart. Okay? And it's different than a panoramic, which that's the pano, the machine that you have to hold and it circles around your head. Different from
Just
that
in the
because
back.
it shows a little more detail with PAs and bite wings. Panos are
Is,
great. Panos shows everything in one big picture.
is
The
that
FMX series,
the picture like behind you, like that?
yes, that's your Pano.
Okay.
Exactly, that's your Pano picture. And the FMX would be just picture, 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 picture. But it would make the entire dentition, just not one full shot of every single tooth. But you still get every tooth, just more detail. Let's see, where did I leave off reading? Um, well, let me just start it over. I don't even know what full mouth. A full mouth survey X-ray is composed of a series of individual images, including a combination of bite wings and periapical. Usually, full mouth X-rays are taken when you're a new patient at your dentist office. They use these initial images as a baseline on the health of your mouth. However, full mouth X-rays are often taken when your dentist suspects you have a jaw cyst or tumor. They're also used for significant dental work such as root canals, extractions, and gum disease treatments. Um, you'll be asked to take bite wings and periapical X-rays during the FMX, of course. I already talked about that. Um, Next kind of X-ray is the panoramic, which is the pano back there. Um, Panel X-rays or panoramic X-rays, just like panoramic photos, are used to take images of the entire thing. So basically, the entire mouth, entire area. It shows the position of fully emerged, emergent, and impacted teeth all in one image. So, uh, yeah, you can see it. You got 1, 16, 17, and 32 back there. They're not out yet, so they're just buds. They're growing. But you also have the rest of the teeth already developed. On mixed dentition, if you were to take a panel on mixed dentition, a child that's 9, 10, 11, who has a lot of permanent teeth but may not have lost some of their primary teeth, you're going to see all of this in that one photo. You'll see the baby teeth or the primary teeth first, and then upper is where you would see your permanents, whether they are already erupt, where they're already grown and they're ready to erupt, or if they're in like the different stages of life, as in like budding, developing, and all of that. You can see all of that. You can also see bones. Make sure you always have a like take off your jewelry, especially if it's metal, because that's gonna show up in a panel. X-rays, I'm sorry, X-rays. Earrings, whenever you take in a panel, is definitely a no-no because not only will it take the picture of the earrings, but it'll also throw off a glare. It's kind of like a ghost glare that'll go over the image. So even though you could be able to see certain things, it'll be super blurry or like really foggy because of the earrings and their little ghost image that it'll throw off. Um, Let's see. You'll be asked to write down on a bite block to keep teeth aligned and attain a clear image. Then a rotating arm on the machine makes a semicircle around your head to record into your mouth. Most of the newer ones, they don't make a semicircle. They make the complete circle, and most of them are make circles 2, 3, 4 times around just to make sure they get everything. I love them. Occlusal X-rays. They help track the development and placement of a section or entire arch of teeth in the upper or lower jaw. They're mostly used by pediatric dentists to find children's teeth that may not have yet broken through the gum. Um, the process is very similar to bitewing X-ray. It's just kind of the arch is kind of different, and I will show that to you in class too. Let's see, that was all I wrote. What those X-rays? I think I went over there too fast. Let's see. Yeah. Um. Yeah, we already talked about that. So what I'm gonna try to do is tomorrow I'm gonna try to go to work like maybe an hour to 30 minutes earlier, and I'm gonna try to get somebody to actually film me taking X-rays. Okay, so what I'm gonna do is I'm gonna try to record the traditional X-rays first. That way you can literally see me like take an X-ray with the traditional film, the paper one that you actually have to develop, actually showing me developing them so you can see how long. And I want it to be live. That way you get to see how long everything takes. As far as the taking it, well, setting the patient up, taking the actual X-ray, developing them in the different stages, because it's 2 to 3 stages depending on your office. And then I want to show y'all a video of me actually taking PAs, bite wings, and a panel. Try to get all of that done tomorrow. That way, when we get in class tomorrow, I should be able to have it. If not, then I'm gonna try to just post random videos throughout the week for y'all. That way you can just try to get the look. So, not gonna hold you too much longer, Flag Man. Do you have any questions on X-rays or anything else?
Mm-mm.
I knew you didn't already. So. All right, ma'am. Just keep looking over this chapter. Look over it, and also study your colors. Okay, study your colors. Red is bitewing. Yellow is posterior in the back. Blue is anterior in the front. Okay. Study those real good. Study. And I will be posting more random videos throughout the week for y'all as far as X-rays. So just kind of check your portal every day just to see if we have a new video. And what I'll do is I'll try to get them all posted tomorrow. That way we can talk about them in class. But if I do post them any other day after tomorrow, just shoot me a text or just write down any questions that you have about it. And when we get in class Monday, we'll talk about it then. Okay.
Okay. I don't know. You've posted videos on there, but I haven't seen any videos posted.
They don't like they don't show up for you.
Yeah, no. I mean, I'll show you tomorrow. Like, I haven't seen any videos unless I'm overlooking them, but
Okay.
I don't see them.
Well, they normally like pop up, so it'll be okay. We'll look tomorrow, and if it doesn't work, then I'll just give you my YouTube account. And because what I do is I save them on YouTube first. If I save it on here, then I save them on YouTube, and then from YouTube I put them on Edmodo.
Okay.
So have them saved Edmodo, YouTube, and on the computer in class. So if you can't access them, then that's what I start doing. I just start giving you my YouTube account, and you can just go check them out whenever you get free. Okay.
Okay.
All right. Any other questions?
Nope.
All right, ma'am. Well, like I say, keep studying, keep doing good, and I will see you in class tomorrow.
Okay. Bye-bye.
Thank you.